Hi everyone, get ready for expert tips, practice questions, and clear explanations, all designed to make your NCLEX journey smooth and stress-free. Subscribe now and let's make NCLEX success easy together. Question 1. A nurse is assessing a client with heart failure who has been experiencing dyspnea. Which assessment finding requires immediate intervention? A. Crackles in the lung bases. Bilateral pitting edema in both legs. C. Jugular vein distension. D. Pink, frothy sputum. Answer D. Pink, frothy sputum. Rationale. Pink, frothy sputum indicates pulmonary edema, a life-threatening complication of heart failure requiring immediate intervention. It suggests fluid overload in the lungs and may necessitate diuretics, oxygen therapy, or ventilatory support. Crackles, edema, and JVD are concerning but not as critical as pulmonary edema. Question 2. A client receiving Digoxin for heart failure presents with nausea, blurred vision, and bradycardia. What is the priority nursing intervention? A. Administer an antiemetic. B. Check the client's potassium level. C. Hold the Digoxin and notify the provider. D. Encourage the client to increase fluid intake. Answer C. Hold the Digoxin and notify the provider. Rationale. Nausea, blurred vision, yellow halos, and bradycardia are signs of digoxin toxicity. The nurse should withhold the medication and notify the provider. Checking potassium is important but not the priority action. Administering an antiemetic or increasing fluids would not address the toxicity. Question 3. A nurse is caring for a client with pneumonia who is experiencing shortness of breath and decreased oxygen saturation. Which intervention should the nurse implement first? A. Administer prescribed bronchodilators. B. Encourage the client to cough and deep breathe. C. Raise the head of the bed to a high Fowler's position. D. Notify the healthcare provider. Answer C. Raise the head of the bed to a high Fowler's position. Rationale. The priority action in managing respiratory distress is to optimize oxygenation by positioning the client upright. High Fowler's position improves lung expansion. While administering bronchodilators and encouraging deep breathing are important, positioning is the quickest intervention. Notifying the provider is necessary, but not the first action. Question 4. A nurse is educating a client with hypertension about lifestyle modifications. Which client statement indicates a need for further teaching? A. I will limit my sodium intake to 1,500 milligrams per day. B. I will exercise for at least 30 minutes most days of the week. C. I will drink 2 glasses of red wine every night for heart health. D. I will check my blood pressure regularly at home. Answer. C. I will drink 2 glasses of red wine every night for heart health. Rationale. While moderate alcohol consumption, 1 drink per day for women, 2 for men, may have cardiovascular benefits, excessive alcohol intake can raise blood pressure. The other statements reflect appropriate hypertension management strategies. Question 5. A nurse is caring for a client with a potassium level of 6.2 milliequivalents per liter. Which intervention is the priority? A. Administer sodium polystyrene sulfonate, KXalate. B. Place the client on a cardiac monitor. C. Encourage increased fluid intake. D. Provide potassium-rich foods. Answer. B. Place the client on a cardiac monitor. Rationale. Hyperkalemia can cause life-threatening dysrhythmias, making continuous cardiac monitoring the priority. KXalate helps lower potassium, but is not the first action. Increasing fluid intake may help if kidney function is normal, but it is not the priority. Providing potassium-rich foods would worsen hyperkalemia. Question 6. A nurse is caring for a client receiving IV Furosemide for heart failure. Which assessment finding requires immediate intervention? A. Blood pressure of 110/70 millimeters of mercury. B. Serum potassium level of 2.9 milliequivalents per liter. C. Weight loss of 2 pounds in 24 hours. D. Urine output of 40 milliliters per hour. Answer. B. Serum potassium level of 2.9 milliequivalents per liter. Rationale: hypokalemia, potassium less than 3.5 milliequivalents per liter, is a dangerous side effect of furosemide, leading to cardiac dysrhythmias. A potassium level of 2.9 requires immediate intervention. The other findings are expected or within acceptable limits. Question 7. A client with diabetes mellitus reports feeling shaky and sweaty. The nurse checks the blood glucose, which is 50 milligrams per deciliter. What is the priority action? A. Administer glucagon, IM. B. Give 15 grams of fast-acting carbohydrates. C. Notify the healthcare provider. D. Recheck blood glucose in 30 minutes. Answer: B. Give 15 grams of fast-acting carbohydrates. Rationale: the rule of 15 applies to hypoglycemia. Give 15 grams of simple carbohydrates, e.g., juice, glucose tablets, then recheck in 15 minutes. Glucagon is for unconscious clients or those unable to swallow. Notifying the provider can occur later. Waiting 30 minutes without intervention can lead to complications. Question 8. A nurse is providing discharge teaching to a client with a new prescription for Warfarin. Which statement by the client indicates a need for further education? A. I will avoid eating large amounts of green leafy vegetables. B. I will have my INR levels checked regularly. C. I can take ibuprofen for headaches if needed. D. I will wear a medical alert bracelet. Answer: C. I can take ibuprofen for headaches if needed. Rationale: NSAIDs like ibuprofen increase the risk of bleeding when taken with warfarin. Acetaminophen is a safer alternative. The other statements reflect appropriate warfarin management. Question 9. A nurse is assessing a client with chronic obstructive pulmonary disease, COPD. Which finding requires immediate intervention? A. Oxygen saturation of 88% on room air. B. Barrel-shaped chest. C. Use of accessory muscles when breathing. D. Respiratory rate of 8 breaths per minute. Answer: D. Respiratory rate of 8 breaths per minute. Rationale: a respiratory rate of 8 indicates respiratory depression, which can be life-threatening. COPD clients often have an SpO2 of 88 to 92%, a barrel chest, and accessory muscle use, which are expected findings. Question 10. A client with deep vein thrombosis, DVT, is receiving heparin therapy. Which laboratory value should the nurse monitor? A. INR. B. Platelet count. C. APTT. D. Hemoglobin. Answer: C. Rationale: activated partial thromboplastin time, APTT, monitors heparin therapy. INR is used for warfarin. Platelet count and hemoglobin are important but not specific to heparin monitoring. Let's know how many questions you answered correctly by dropping it on the comment section below. Please subscribe, like, and share. We love you.